This video reviews 100 common heart and cardiovascular diseases. The purpose is clear: to help more people understand the danger of heart disease, recognize warning signs earlier, respond faster, and live longer, healthier lives. Heart disease can start with mild symptoms, but some conditions can become life-threatening. Each slide groups 10 conditions. The image is a representative public license reference. Real diagnosis and treatment decisions require clinical history, physical examination, ECG, blood tests, echocardiography, and appropriate imaging. First, coronary artery disease and myocardial ischemia. These conditions involve reduced blood flow to the heart muscle. Chest discomfort, duration, shortness of breath, cold sweat, ECG changes, cardiac enzymes, and risk factors must be assessed together. Second, arrhythmias and conduction disorders. The heart may beat too fast, too slow, or irregularly. Palpitations can be benign, but syncope, stroke risk, or cardiac arrest can occur. A properly interpreted ECG is essential. Third, heart failure and cardiomyopathy. These conditions affect the heart's ability to pump or relax. Shortness of breath, leg swelling, breathlessness when lying flat, reduced exercise tolerance, and echocardiographic ejection fraction should not be ignored. Fourth, valvular heart disease. Heart valves keep blood moving in the correct direction. When a valve narrows or leaks, pressure and volume overload can accumulate. Murmur location, chest pain, dyspnea, syncope, and echocardiographic severity guide decisions. Fifth, congenital heart disease. These are structural heart conditions present from birth. Cyanosis, heart murmur, poor growth, low oxygen saturation, and repeated respiratory symptoms require careful structural evaluation with echocardiography. Sixth, inflammation and infection of the pericardium or myocardium. Some cases look like ordinary chest pain, but myocarditis, tamponade, or significant pericardial effusion can deteriorate quickly. Fever, positional chest pain, ECG findings, cardiac enzymes, and echocardiography matter. Seventh, hypertensive and pulmonary vascular heart disease. Long-standing systemic hypertension and elevated pulmonary pressure can overload the ventricles. Poorly controlled blood pressure, unexplained dyspnea, right-sided failure, and pulmonary hypertension require active evaluation. Eighth, aortic and peripheral vascular disease. Aortic dissection is a time-sensitive emergency. Sudden tearing chest or back pain, blood pressure difference between arms, pulse deficit, and CT findings require immediate attention. Ninth, cardiac emergencies and major syndromes. Cardiac arrest, cardiogenic shock, pulmonary edema, and inherited arrhythmia syndromes can worsen rapidly. Severe chest discomfort, syncope, shock, cold sweat, or altered consciousness should be treated as emergency warning signs. Finally, systemic diseases that affect the heart. Diabetes, kidney disease, thyroid disease, cancer treatment, and inherited conditions can directly affect the cardiovascular system. Patients with underlying disease should take cardiac symptoms especially seriously. The point of this video is not to create fear. It is to prevent missed warning signs. Chest discomfort lasting more than a few minutes, shortness of breath, pain or discomfort spreading to the arm, back, neck, jaw, or stomach, cold sweat, nausea, lightheadedness, fainting, or severe palpitation should not be ignored. The earlier heart disease is recognized, the more time there is to save life and preserve health. If these warning signs are present, seek emergency medical care immediately.